Indian patients, they may have some apprehensions about approaching a male gynecologist for examination. So have you faced those biases, prejudices from patients and even from the people in your own department, be it consultants and other residents, about having a male gynecologist?
Academically or procedure wise, I don't think there's much of a difference if it's a male or a female, because especially when you're working in a government hospital, the patient load is going to be so huge that nobody really bothers. They just want some kind of care and they're ready to receive it from a female or a male.
Why did you decide to take gynecology as a branch?
Gynae has always been my choice right from a very young age, and I've stuck on to it and I'm very happy with it.
What is the expected salary a beginner can expect while joining as an associate or consultant in private hospitals in Tier 1 and Tier 2 cities?
If you're planning to work as an SR or a registrar, unfortunately the salary is quite low, starting of maybe 80 to 90,000 to maybe it'll max stretch to 1.2 lakhs.
If you plan to start your own center, your own setup, at least in a very initial stage,
if it's a small clinic, it's no brainers. You can just set it up with maybe just basic interiors, maybe 1 or 2 staffs and the basic equipments of a bed or whatever can be done.
How your day passes as a gynecologist and what are the different procedures that you do?
I finish my cases in the morning and then see my patients, and evening is mostly appointment based. So I have more or less got control over my life as to when I do my procedures and how I do them and how I plan my day.
Hi, I'm Dr. Rahul Chawla. Welcome to episode 10 of NEET PG mentoring sessions. Today I have Dr. Akshay Prabhu, who will be guiding us about gynecology as a branch. He has done MBBS from AFMC Pune and MS Gynaecology from KMC Manipal. And right now he is practicing as a gynec laproscopic surgeon in his own hospital in Kochi, Kerala. Welcome, Dr. Akshay.
Thank you, Dr. Rahul. Thank you for having me here. It's a wonderful series you're doing.
So we'll start this session from a usual line of conversation. Why did you decide to take gynecology as a branch?
Dr. Rahul, to be very frank, the thing is I've been a single child. So right from a very young age, I've seen my mother work. She's a gynecologist. So from a very young age, I've been exposed to this branch. So even after school, my school was very adjacent to the place where my mom was working. So post school hours, I used to go and sit in her OPD, a consultation room, maybe near the labor room. So right from childhood, the only thing I've been exposed to is this branch. So as I grew up, all these effects, I think, had a concrete impact on my brain and my choices also. So when it was time to choose a branch after even 12th standard, whether doctor or engineering, I never even went for engineering. I directly only gave the MBBS entrance, and that's how I entered AFMC. So even post AFMC, when I was doing my internship, I was somehow very sure that gynecology is the branch which I want to choose. Only slight variation I can say is that maybe I had some inclination toward general surgery because I like surgical branches, but 99% sure I wanted gynecology. So gynecology is something I have taken absolutely by choice. Whatever be my rank, I was very sure that I wanted gynecology. So this is one message I would like to give to all youngsters who are aspiring is, be it branches like gynecology or pediatrics, you should take it only by choice, not by lack of choice. Because if you take it only by choice, then whatever hardships or difficulties you face down the lane, you'll at least be sure you're doing it by choice, not because somebody else has forced you to do it. So Gynae has always been my choice right from a very young age, and I've stuck on to it and I'm very happy with it. That is how I've landed up in this branch.
Well, glad to know that. Male gynecologists are not that common. And Indian patients specifically, they may have some apprehensions, and if not patients, at least their husbands will have apprehensions about approaching a male gynecologist for examination. So have you faced those biases, prejudices from patients and even from the people in your own department, be it consultants and other residents, about having a male gynecologist?
So even before entering the branch of gynecology or pursuing my post-graduation, I didn't have much of apprehensions about the subject because, as I told you earlier, I was exposed to it always. Even the practical aspects of it, I was exposed to it because my mom owned a hospital. Even during my house surgency, I used to assist her in many of her procedures. So that kind of apprehensions I did not have. And I was also exposed to the fact that this community of gynecologists, it's mostly 95% it's females, and there are only very few males. But working in a government hospital for my post-graduation, we were working in the Mangalore district hospital, which is also called as a Lady Goshen hospital. So the entire, almost 20% of the Mangalore population comes and delivers there. So we didn't have that kind of bias because they were all needy patients. They needed some kind of care. But when I went there, I was a bit shocked to see that every batch only had a single male PG. Out of 10 intakes, 9 were females and only 1 male PG was there. And this was a very interesting pattern. 2 batches prior to me had 1 single male PG. So when I was in first year, there were entirely 30 PGs, out of which 3 were males. But unfortunately, when I graduated to second or the third year, my next two junior batches did not have even a single male PG. Intake was completely female. So by the time I was finishing my post graduation, I was one male PG and 29 female PGs. Other than that, academically or procedure wise, I don't think there's much of a difference if it's a male or a female, because especially when you're working in a government hospital, the patient load is going to be so huge that nobody really bothers. They just want some kind of care. They cannot afford it. They want some kind of care, and they're ready to receive it from a female or a male. One added thing I can say is that males are slightly more empathetic, is what I personally have felt. I may not be absolutely right, but what I felt is because, see, ladies go through this phases of menstrual cycles, the pain, and a lot of other issues. Some even have delivered a kid when they have joined the post graduation, so they've gone through all this pain. So once you go through that pain, then you don't feel that what others are going through may not be very significant. But for us males, as you and know me, we have never gone through a menstrual cycle. We don't know what the pain of a menstrual cycle is. So whenever you see that pain when a patient is delivering or laboring, that really hits you hard and that makes you extra empathetic, is what I've personally felt. So to summarize your question, apprehension wise related to subject, really no. Apprehension to enter a post-graduation subject where maximum is females, that was initially short-lived. After a certain point of time, I felt it became a plus point for me.
Yeah, very nice perspective, Dr. Akshay. So you may not have seen the movie Dr. G of Ayushmann Khurrana, I believe. So in that movie, Ayushmann Khurrana did not want to choose gynecology as a branch. He was forced into that, and but then he liked the department. But then there were many biases and prejudices that he had to face. And I think there is a difference how the community perceives gynecologists in North India versus in South India. So maybe in your case, you did not see that much of biases and judgments, but otherwise it's more difficult to practice in North India, specifically Rajasthan, Uttar Pradesh, Madhya Pradesh, these kind of states, for a male gynecologist. And that is why we really don't have that much male gynecologist as we have in, say, West Bengal or in South India.
Even in South, in the initial phases, it is not very easy for private patients to accept a male gynecologist. I was talking about my experience during post-graduation where patients didn't really have a choice. They came to us because they were needy, they needed care, they were willing to undergo whatever care they are getting. But when you come to the private setup, even it took me around 3 to 5 years at least for patients to get comfortable with me doing a PV. And that level of comfort, it really takes time, maybe more in North India, lesser in South India, which as you pointed out rightly.
So moving ahead, how had your experience of residency in gynecology department been, given the fact that there are so many memes circulating about gynecology residents, and we have also seen during our internship the kind of struggles a person has to face in gynecology department because of the magnitude of workload, and only most of them are females. There are many fightings that are going on. So what is the truth in those memes?
Rahul, thank you for asking. I just want to add on a few points also. As you said, unfortunately, I had not seen the movie which you had mentioned, where Ayushmann Khurrana had difficulty in adjusting. So this is one point which I really stress always whenever somebody comes to me asking for gynecology post-graduation as a subject, be it a male or a female. Why are you choosing gynecology? Like, why did you come to this branch? Because my answer was very clear. I'm taking this out of choice. So I was very shocked to find certain answers saying that यार लड़की है तो घर वालों ने बोला गायनेक ले ले. Second is my husband is a physician or a pediatrician or an orthopedician, तो उसके लिए एक supporting branch गायनेक is very good, so गायनेक ले ले. Like, see, this subject which you're going to take for post graduation, this is going to be what you're going to be practicing. If you don't choose it, if somebody else chooses it for you, you're going to keep cribbing, keep getting frustrated, and that frustration is going to get transferred to the patient. This is what happens in reality. The second thing is that as you pointed out about the memes, see, as stressful the department is or the subject is, there is definitely going to be a lot of fighting. One shock which I got was that during my MBBS, we had a lot of good friends during MBBS. We were all jolly going, we were happy. We just had our basic studies to do, clinics to attend, play, enjoy, go for trips, do whatever it is. We were all friends. We were all doing it together because there was no workload to be shared. But the moment I entered PG, I expected that same kind of environment there. And I was shocked to find the 180-degree opposite environment, because there is work. Work is unlimited, hands are limited. If I don't do it, somebody else has to do the excess work. So it is always a push and pull which is going to happen. And the more stress there is in the department or the subject, the more amount of infighting and issues and whatever politics is going to be there, that is going to be a part and parcel of it. It is directly proportional and it cannot be avoided. That is a truth, or that is a reality which I have lived with and which I tell others also.
So, Dr. Akshay, how necessary is completing senior residency of 3 years in gynecology, or is it like even 1 year SRship will suffice, or is it a possibility that a person can get job even without completing SRship in private sector?
To answer that question of yours, I get this query from junior postgraduates quite often. So my take on that is, in gynecology specifically, if your post-graduation exposure is very good, you have seen almost all kinds of cases, your hands-on is good, you have worked in a very good department, I would say there is no need to do a SRship to gain more experience, because any place which is busy with a good caseload, it's going to be obstetrics. And maybe a little bit of gynecological exposure, maybe to laparoscopy, infertility, and urogynecology or gynecology, maybe. But any high caseload center is going to be high caseload for obstetrics. So if your exposure is good during your post-graduation, there is no need to do an SRship unless and until it's mandatory, because you're not going to gain much during it. So even in PG of gynecology, a lot of people don't go for SRship unless and until it is absolutely required or mandatory. And that's my personal take also on it. And I never did an SRship. And job wise also, I don't think SRship is actually required to get a job, because in gynecology, you are good enough after post graduation if your exposure has been good.
Okay. And what are the different options we have for fellowship and for super specialization after completing MS?
In gynecology, fortunately or unfortunately, the fact is that even after post graduation, you are maybe highly proficient in the obstetrics part of it, but there are a lot of skills which you don't acquire because government hospitals really don't have those sectors or sub department or super specialties, what you call it. So just to summarize, one of the premium sought after fellowships is laparoscopy, is what everybody tries for. Compared to early days it was a super specialty. Now a basic level of laparoscopy skills is mandatory for every practicing gynecologist. Second is infertility and IVF. Third is you can go for urogynecology specifically. Four is you can go for gynae-oncology. And five, now cosmetic medicine has come up in a big way. So that is also has become a sub or a super specialty. So these are the various fields. And one additional thing is fetal medicine. So this 6 fields are something which you can call either a sub or a super specialty, which a gynecologist can steer into and specialize and become maybe an expert in it.
Okay.
So in order to add to this, one small thing I can share. So as soon as I finished my post-graduation, my primary interest was gynae-oncology. So even before my results came, I had applied to Tata Memorial for a observership, and I went and worked there for a month. But just by 2 weeks, I realized that at that phase of life, gynae-oncology is not something which attracted me. So by 15th day, I was quite sure about it. So I jumped to my next field of interest, which is laparoscopy. I did a 2-week laparoscopy fellowship. That ignited a lot of interest in me. And next is I did a 1-month course in ultrasound, because the exposure to ultrasound is highly limited during post-graduation, which is very unfortunate. It had to be very good, but it is highly limited. So I did 1 month of ultrasound fellowship, and that also was quite interesting. So after doing all these things, I came to a certain amount of conclusion that laparoscopy is something I want, and then I started going deeper in that aspect. So one advice I would like to give to all people who are coming out fresh from post-graduation: don't jump into any single specialty and stick to it, because I know people who jump directly into fetal medicine, go and do a 1-year course, and then they realize after practicing that fetal medicine is not what something interests them. Then they jump to infertility. After a certain point of time, they jump to laparoscopy. So before you want to really settle down, utilize a lot of short course fellowships are there just to have an exposure to that field, to see whether you're actually interested. And if you feel interested, then you can take longer fellowships or dive deeper into it and maybe become an expert in it. Otherwise, still you're not sure, stay in a setup where everything is there and do these short course fellowships to just test your interests.
Okay, very well explained, Dr. Akshay. So can you please enlist some important institutions and the fellowships which they offer, which are renowned all over India, like be it AIMS or PGI or any other institutions which are offering fellowships for gynecology?
So institution-wise, I am not really aware of much of fellowships which are happening, because institution-wise fellowships are always long-term fellowships. In my life, what I've done is short-term fellowships. So there is this option of doing MCH in reproductive medicine now. There is an option of doing MCH in urogynecology and gynae-oncology. These are the 3 super specializations which are present in gynecology. So doing this super specialization is useful for those people who are planning to join either institutes or corporates, because you don't have to climb the ladder from the base. You'll get a medium level position, you'll get a consultant level position. But other than that, doing an MCH is not something I would advise, because that's again a 3-year thing plus maybe 1 more year of post MCH work. So institute-wise fellowships will always be longer term, and FOXY recognized or ICOG recognized fellowships will always be long term. But there are n number of institutions, or institution I mean private hospitals or private experts.
So, Dr. Akshay, once passing out of MS Obs and Gynecology, what is the expected salary a beginner can expect while joining as an associate or consultant in private hospitals in Tier 1 and Tier 2 cities without any fellowship and super specialty degree, and with a fellowship and a super specialty degree?
Once you finish your post-graduation, if you're planning to work as an SR or a registrar, unfortunately, the salary is quite low. What I discussed with my peers is you get approximately somewhere between starting of maybe 80 to 90,000 to maybe it'll max stretch to 1.2 lakhs. That is a base level salary you can expect as maybe a senior resident or a registrar. This may stay same for 1 or 2 years before you maybe graduate to the next level. But if you're joining after fellowships or having some skills in hand, this can come up to somewhere between around 1.5 to even maybe stretch to 2 lakhs. That is if you can promise some value based on your skills. But to get anything more than 2 lakhs as a beginner or within the first 2-3 years is very difficult in this branch. And may have to stay in the same phase for maybe 3 to 5 years before you get your next raise or a next promotion, which might jump you or might take you somewhere between 2.5 to 3 if you started with 1.5 to 2.
As compared to your peers in the medicine branch and medicine super specialties, where the beginning salary is comparatively better and the promotion is fast. So you have to face lots of hurdles in gynecology. So what after 3 to 4 years, if you plan to start your own center, your own setup, at least in a very initial stage, what are the basic requirements for starting your own setup? What are the equipments that are required? And what is the expected expenditure? Something that is very basic and very minimal that is required to start your own setup.
In obstetrics and gynecology, what mostly happens is that it's 80% of obstetrics and 20% of gynecology. So once you finish your post-graduation, you're more of an obstetrician, and now you are on a journey to acquire more skills in form of fellowships or other things. But in, for example, a branch like general surgery or internal medicine, there are specific DMs or MCHs which are there, which once you acquire, then you become a specialist in that. For example, like you become a neurologist. You are an authority in that field. There is not going to be any parallels like that. For example, a gastrosurgeon or a neurosurgeon, he's going to be an expert in that field. But in our field, what happens is that even if you acquire an MCH also, there are only 2-3 MCHs. So, for example, you take an MCH urogynecology. This can even be done by a urologist also. A urologist is going to have more or less same skill sets, maybe a little different. You take MCH gynae-oncology. A surgical oncologist is also going to do more or less of your work also. So you're not going to be an authority in that field. MCH reproductive medicine is something which gets you an authority, but you really don't have to do an MCH in that. You can do a fellowship and also become an authority in that. So super specializations in our field really don't add that kind of value, just like the other field. So once we finish our post-graduation, we are basic obstetricians who come out. Now we are on our way to acquire many skills. So in order to join somewhere and work, you again begin that climbing that ladder. But if you really have to start your own setup, I would say it's really challenging in these times because, as you're very aware, medico-legal issues are maximum in obstetrics and gynecology, maybe followed by ortho. So just like how my mom started out, she started this maternity hospital, whatever hospital I'm working in, which we are running as a family. She started it back in 97 as a pure maternity hospital. She was a single obstetrician here. My father is a chartered accountant. He was managing the professional and the administrative and the financial side. So she was a single obstetrician who has dedicated her life to this hospital, doing deliveries day in and day out, 2 to 3 deliveries per day. You don't know when you're awake, when you're asleep, that's going on. And that was a trend till around 2010, 2015. Nowadays, it is unimaginable to think of such a situation because doing work as a single obstetrician is nearly impossible now and not heard of. So it is not really advisable to start off your clinic or hospital as a single obstetrician. What people do is either they form a group of obstetricians, like 4-5 people in the same locality, join together and start a hospital so that if one goes on leave, other people cover up, or they can do it that way. Secondly, other plan what now people are doing is that if they don't want to join a corporate or institute, they start these small standalone consultation clinics and they promote themselves so that they see patients there throughout this thing. And whenever they have to admit some patient, they have an association with 2-3 hospitals. One may be a small hospital, one may be a corporate hospital, one may be a middle level hospital. So you have tie up with 2-3 hospitals so that based on the patient's interest and financial capacity, you can associate with those hospitals and admit them there and do it. And if you don't want to fall into these two, you either join an institute or a corporate because you get security. So in all this, one baseline I would like to convey is that it's always a choice between freedom and security. If you want security, you can join an institute or a corporate. You'll get a fixed monthly salary. There'll be cover. There'll be hierarchy over your head. You'll be taken care of. You just have to do your work, but you won't have much of a freedom. But if you want to have your freedom, you'll have to start something of your own, maybe a small clinic, or join with a group of people, or take over a family clinic or something. Freedom will be there, but there won't be security, and there'll be a lot of hardships also. So finally, it matters what you want. Based on that, you can decide what you want to do. And if it's a small clinic, it's no brainers. You can just set it up with maybe just basic interiors, maybe one or two staffs and the basic equipments of a bed or whatever can be done. But if you're going for a small hospital, the level of investment will be slightly higher. It will be running into lakhs. And nowadays you've got a lot of consulting agencies who are doing it for you, based on the amount of space you want to do and the amount of specialties you want to build in the same space.
So can you please briefly tell us about how your day passes as a gynecologist, and what are the different procedures that you do?
So for me, my days are quite well planned because me being an exclusive laparoscopic surgeon, almost 95% of my cases are planned elective cases. And just the emergency cases which come one like very occasionally are ectopic pregnancies and torsion ovaries or torsion cyst is what I get as emergency. Rest everything is more or less planned surgeries. And out of which I would say around 80% of them would be either a total laparoscopic hysterectomy or a laparoscopic myomectomy, followed by minor procedures like laparoscopic ovarian cystectomy, diagnostic histolaparoscopy, ovarian drilling, sterilization. These are minor procedures, but the bread and butter, the chunk of it will be laparoscopic hysterectomy and myomectomy. So usually I prefer doing my cases in the morning. So I finish my cases in the morning and then see my patients. And evening is mostly appointment based. So I have more or less got control over my life as to when I do my procedures and how I do them and how I plan my day. So as I said earlier, I am associated with 5 hospitals, out of which 2 are outside the district. So Wednesday is a day which I've kept for one side, which is beyond district in one direction. And Thursday is another day which I travel in another direction. So those 2 days are exclusively kept for those districts. And those days I don't plan any electives in my hospital or in hospital surrounding here, unless and until it's an emergency. And more or less rest of my day is planned. And as I'm owning a hospital also, I have to dedicate some amount of time for the administrative and the managing part also. So this helps me. So evening I dedicate some time, maybe an hour or 2 per day, for the managing and the administrative activities of the hospital.
And when we talk about administration and managing a hospital, marketing is a very important aspect of running a hospital. And for all the doctors out there, be it gynecologists or any specialty, marketing is a very different tool. And the way marketing was done earlier is completely different from how the marketing is being done right now in this digital age. So can you please share with us some pearls about marketing and how you go about marketing of your own hospital and your own practice?
You absolutely said it right now. See, any institution, be it a small hospital, medium hospital, or large hospital, cannot survive without marketing. You have to tell your potential patients, they say potential clients or customers, they say, but your patients that you exist. Because nowadays the density of hospitals is so much, the density of doctors is so much that there should be something which makes you stand out, or at least make you visible so that people approach you when they need you. But one aspect I've learned is that marketing really differs for every level of a hospital. For example, a small hospital like us, the kind of marketing we do or the kind of people we are trying to reach is very different from the kind of marketing corporates do. So there is a difference in the depth of pockets, difference in the finance, difference in the target audience. So you should try not mimic what happens in the general market or so. You should try and define what hospital you are and what kind of target audience you are looking at. And you have to find out where your target audience exists. So because younger crowd nowadays, everybody knows exists on Insta. Maybe a slightly older crowd exists on Facebook. Maybe some category, some hospitals in the rural area do really good when they run radio ads. These radio ads are good because their target audience exists there. So first you have to find out whom you're speaking to, your target audience, and where they exist. And based on that, you should run an ad. Just to make a clear-cut example, for example, a small hospital like us, doesn't make sense keeping a hoarding worth 3 lakhs at a very busy junction. Because even if that hoarding is there, even if you spend so much of money, you're not able to cater the kind of crowd which it's going to pull. If you have a 20-25 bed, the kind of crowd it is going to pull, you're not able to cater. So just placing a hoarding at a busy junction for a small hospital may not work. And maybe running a lot of promotion campaigns on Meta or YouTube also may not help. So basically defining your target audience and directing your marketing for that specific target audience really helps in promoting yourself, and having a personal brand help, because nowadays what happens is more than hospital, a lot of people prefer going for that particular doctor rather than the hospital name. So having a personal brand really helps, and I've been working on it for some time. And just to add one more point, it's personal branding or the LinkedIn presence which has actually got us this conversation also. We have met through LinkedIn. That is what has got us this conversation. So every platform has its significance, and you have to bring it down to for that significance and tailor it for that. That is what I have learned in past 2-3 years.
Yeah, very nicely explained, Dr. Akshay. And definitely, LinkedIn can really never be undermined, not just with the interaction between the doctors, but also with the patients. And also, LinkedIn also generates good SEO with the Google search. Apart from that, how has been your experience with the Google business profile? Do you have that profile, and do your hospitals also have that profile? And how do you manage that? And do you also utilize advertisement with the Google?
Google business profile is something we have for the hospital, and it's really doing well, because by far what I've realized is Google review is something everybody trusts, because that is something which cannot be manipulated. So our hospital has got a very strong Google review, and we try and ensure that every patient who comes to us, who are either satisfied or not satisfied, also we encourage them to put a review on Google, be it a positive review or negative review. Positive review helps us grow our patient, or helps us reach more customers or patients, but a negative review gives us a self-reflection. It's a mirror for us, and we want that in public also. So we respond to every single review which is posted on our Google business page. Initially I used to do it myself. Now I've got a team to handle it, so that no single review gets missed, because it's something a patient is taking an effort to put a review, means you have to acknowledge that effort, and that small acknowledgement itself will make that patient happy and make other people also put more reviews or come to you.
And you are also doing advertisements with that, and does that help for local SEO?
Google ads, what I realize is that when we run ads on Google, we get a lot of leads for that, but the leads are not really effective leads, is what I realized. So many agencies, or 1 or 2 agencies which I work with, through Google ads, the spend is higher. They drive a lot of money through Google ads, and you get a lot of leads, but when we really see those effectiveness of those leads, is not, the quality of leads is not very good, is what my personal experience is. Maybe people have a difference of opinion, so it has not really worked for me.
And yes, organic word of mouth marketing is the best marketing we doctors can have. But over a period of years, that is really reduced, because the interaction between people has not been the same as it used to be earlier. And also, people really don't recommend doctors or any other community as they used to earlier. So have you faced that as well in your practice in last 10 years?
It's a very interesting topic you have brought up. So my personal take on that is that word of mouth has been one of the best modes of marketing earlier, but even now the word of mouth really holds a lot of value, especially in our field, in the field of gynecology and obstetrics. Because see, for example, if one patient tells some other patient that we got pregnant after seeing this doctor and we delivered there, our journey was very satisfying, fulfilling, it has been wonderful for us, you should also go there. It holds a lot of value when they tell to other people. But the catch is here that earlier it was only word of mouth. Now what happens is, if you even have that word of mouth, when you tell that second person that this hospital is good, the first thing that person is going to do is pull out his mobile and search for that hospital. And if you're not present there at that point of time, that is going to put off that patient. So word of mouth still exists in a pretty good way, at least in our branch. But word of mouth combined with that good digital presence is what is going to give you that value. If somebody tells somebody else about this hospital or this doctor, and parallelly if you are found on digital media in a very good way, it's very highly likely that patient is going to come. I've got a lot of patients who sit and Google me in front of me also. Like, for example, some other doctor has referred to me and I say this, and they say this is it. They even Google me in front of me, or they see my videos in front of me. So digital media is something we cannot ignore in today's age. But if that is coupled with a very good word of mouth, and I feel that can work wonders.
Well, that is very nice perspective again. So moving ahead to the final phase of conversation, we have talked about marketing and digital marketing specifically. So, on Instagram, there are so many people who have, they have become online gynaes by themselves, the self-declared health influencers, or health influencers as I call them. So now there has been many videos circulating about PCOS, about endometriosis and various gynecological problems. And so how do you find them, and what exactly is the truth behind all those videos? Okay, for PCOS you have to eat those things, you don't have to eat those things, you don't have to take consultation from gynecologist for PCOS, it's a lifestyle disease, do these yoga asanas, or just do intermittent fasting and your PCOS will be gone. There's so many things which are circulating. So how to counter that myth, and what is your take on that?
Dr. Rahul, whenever you talk about health influencers, one line has stuck with me once I read it, and it has been with me ever since, that it's a shocking fact. For example, a person who has to become a neurosurgeon, he has to go through 4.5 years of MBBS, 1 year of internship, then again 3 years of general surgery, and then again 3 years of neurosurgery, and exams at every phase. After doing all this, he becomes a neurosurgeon, and maybe for a surgery, he'll get somewhere between 50K to 1 lakh to begin with, or at a moderate level. This is what a person who operates on something enigmatic like the brain gets. But a health influencer, to put out one reel there or one collaboration there, gets maybe somewhere 3 to 4 lakhs. That is without even a degree, without any education. You Google up or use ChatGPT and make that health influence information and you put it out there. And based on your number of followers, you get this much amount. So that is the kind of disparity which exists in the society. And you get more viewership and more importance for those health influencers. I'm not saying all health influencers are bad or all influencers are bad. There are a lot of people who do their own research and come out with good data also. But majority of them just throw it out just like that without any facts in it. So as you pointed out, PCOS also. See, PCOS is clearly a lifestyle disease. It's a lifestyle disease which is affecting the hormonal cycle, which causes a lot of issues in the patient. And as you very well know, earlier we used to talk about myocardial infarction, heart attack, blood pressure, and diabetes in 50s and 60s. Now it is very common in 30s and 40s. And the same trend, what has happened is, right from a very young age, a lady being a lady, because of her hormonal cycle, which gets switched on by maybe 8th or 9th year, all these irregularities and all these lifestyle issues have started coming at a very young age. Be it a gynecologist or a doctor or anybody, even I tell my patients the same thing. See, PCOS is a lifestyle disease. It's a problem of a lifestyle modification. The core issue or the core correction which is required is just lifestyle modification. If you are able to do that, well and good, it will get corrected on its own. But if you're not able to do that, if you have been trying for such a long time, we'll give you certain medications just to tide over that phase so that you can correct it in maybe 6 to 12 months. And after that, wean off the medications. We are not here to pump you with medications. It is just a stopgap arrangement. But if you are ready to do your exercises and get your diet corrected by yourself without any external influence, then you don't need all these things. Best would be to follow what your granny was following, because your granny's age, there was no PCOS or anything. They were following whatever was natural and doing it in the right way. So if you can follow that, well and good. You don't need any influencer or you don't need any advice or any course for that. This is what even we say. It's not that we doctors pump in them with medication just because you're PCOS. So that is the truth of it, what I feel.
Yeah, very well explained, Dr. Akshay. So I think we have reached the final phase of our conversation. It was really great to have you here, and you shared really great insights about gynecology as a branch and about starting your own setup and marketing in that field, about your own subspecialty. And I hope the students will take some cues out of it, and that will help them take a wiser decision. So all for it now. It was really great to have you here on our 10th episode. Thank you so much, Dr. Akshay Prabhu, for your time.
Thank you, Dr. Rahul. It has been a wonderful session. It has been a wonderful initiative. And I hope there are a lot of take-home messages for the junior aspirants from this. And I also sincerely hope that seeing these sessions, more specialists come forward to break the myths and misconceptions which are associated with various subjects or departments and to guide people to go forward in this journey. That is what I sincerely hope, and I congratulate you for taking this initiative.
Thank you so much for your time.